Hi, this is Robert Rogers. I'm an allergy immunology specialist in Fort Worth, and I'm a member of the Tarrant County Medical Society. I thought I'd share with you how I make decisions about wearing masks these days. This is January 7th when I'm filming. In Tarrant County and North Texas, we're in the midst of a major surge of the Omicron variant of the coronavirus. So, for example, yesterday, Tarrant County reported over 6,000 new cases, which is the highest number I have seen throughout the pandemic from the very beginning. And certainly that's a major undercount because lots of people are doing home testing and not reporting it. So if you're out in the community, you're going to be exposed to people that have coronavirus. Some of them know they have it and they're sick and they still go out. Other people are in that 2-day window from when they've been exposed to when they start developing symptoms when they can still be contagious. There's a very nice graph that we're going to link to this video that shows if one or both of the people are wearing masks, how much longer can you have exposure without a risk of becoming infected. So this would be one person infected, the other person not infected, and whether either or both are wearing different types of masks. I think we're pretty confident now in saying that Omicron is a very, very contagious virus, and cloth masks, which are certainly the most comfortable and most worn in the community, probably aren't doing a lot of good. I certainly don't feel comfortable personally thinking that a cloth mask is protecting me from like patients that I'm seeing in my office. And certainly if I'm out in the community shopping at a store, I'm not going to wear a cloth mask. The next step up in quality of mask is the surgical mask, and of course you see these everywhere. They're the ones that have the folds, lighter material. When you put them on, the dilemma to me is that you've got this potential gap on the sides so there's a certain amount of leakage around these, and I think that it's not as much protection, certainly better than a cloth mask. And if both the infected person and the non-infected person are wearing a surgical mask, you significantly reduce your risk of getting a substantial dose. The mask I've been wearing throughout the pandemic is a KN95. These are actually readily available now for my life and for the people I care about, which actually is you too, but I mean my family members and my friends. I certainly encourage them if they're going to be in a situation where there are a lot of people around in an indoor environment that I would wear a KN95. They go on like this. They're easy to take on and off. It's not like the N95s that certainly if I were in an emergency room or in a hospital setting where I knew I was being exposed to infected people all day long, I would want to have a well-fitted N95 mask. But the KN95, I think for most of us, is a very reasonable option. With the surge being the way it is, if I'm going to be in any indoor environment anywhere, in my clinic here, if I'm shopping, I'm going to have a KN95 on the whole time. Knock on wood, I haven't been infected yet. I've been using that strategy throughout the pandemic. Now, of course, my luck could run out today. But anyway, that's how I make the decision. Certainly during this surge, I think it is very risky to be indoors without a mask on for any time at all. I don't think that applies when we're not in the midst of a surge. And I think when our numbers are lower, going to a restaurant and eating indoors is actually a reasonable choice. Right now, I personally don't think it is. I know not all of us have the same level of risk tolerance, and I tend to be a pretty cautious person by nature. But that's how I make the decision. I hope this is helpful to you. Thanks.